Sigoli Sigwe. Gajijawaks is my Ongwe Hongwe name, and my English name is Christi-Ann Poulette. I am Haudenosaunee from Oneida Nation of the Thames and Mi'kmaq from Member 2 First Nation. I am a registered nurse.
Kwikwayanee, Nicole Blackman, Indigenous, Algonquins Pikwakagon and Dunjaba. Hi everyone, my name is Nicole Blackman. I'm a proud member of Algonquins Pikwakagon First Nation. I'm of mixed ancestry, German on my mother's side and Anishinaabe on my father's side. And I am also a registered nurse.
As an Indigenous nurse, I believe in treating people as whole beings, not just their health problems. I focus on a person's mind, body, spirit, and surroundings as all connected.
I agree with that. I think it's really important when we're working in Indigenous health as well to emphasize the importance of resiliency, cultural strengths, and community connectedness. It's also really important to bring in the traditional components and ensuring that traditional knowledge systems are embedded within the contemporary health practice that we work within.
I also believe that it's very important to build trust with the patients that I'm supporting, really respecting their diverse backgrounds and ensuring that I incorporate their beliefs and practices within the care delivery that I provide. I think ultimately in the end, my care is based on respecting and valuing individuals, especially the diversity that exists there, to promote their health and well-being as well as that of their community. I've had a great opportunity to work with many different nations and really to be exposed to different cultural practices and beliefs throughout my time as a nurse. And I really think that it's vital to be aware and reflect on an individual's practices and beliefs as much as possible.
And I think for me, it's not necessarily about the practices that differ, but it's about the access to culture that differs. So I've worked in the North, and when I've worked in there, there's been greater access to ceremony or traditional practitioners. But sometimes in the South, depending on where you live, there may not be as much access. And so if you don't have an Indigenous-led organization, like an Indigenous primary health care organization or an IPHCC Friendship Center or something in your area, you may not have access to ceremony or culture or traditional wellness practitioners. So that's why we really push to have more Indigenous-led organizations spread throughout the province, just to increase that access. So two-eyed seeing is a guiding principle that was introduced by Elder Albert Marshall from the Mi'kmaq Nation. And in the context of Indigenous health, it's a powerful and respectful way of approaching knowledge, health, and wellness by bringing together both Indigenous and Western worldviews. And it's not about blending or assimilating one or the other, but it's about respectfully weaving them together and bringing together the strengths of both knowledge systems in order to be able to offer a more complete and inclusive way of understanding and promoting health.
I agree. And I think it's really important for practitioners providing healthcare to Indigenous people to really be aware of this so that they can ensure that both perspectives are embedded in the care delivery and that they both complement one another. For me, I've always tried to make space for both perspectives to be present in healthcare, allowing families to practice ceremony, to address traditional beliefs that they want embedded in their care, as well as incorporating the Western medical treatment aspect to one's care. And I think to me that I found that this provided a deeper sense of trust and a relationship building between myself and those that I help serve.
I think for me, an example is during the time of COVID when we worked in partnership and collaboration with public health units to be able to take a multifaceted approach to the vaccine clinics. So ensuring that the Western practices were embedded with the vaccine policies and practices that needed to be in place, but also ensuring that there was space for elders to be there to provide care. There was openings done and there was drumming even done. So just making sure that we created a culturally safe and appropriate place to hold the vaccine clinics. I would say that Indigenous practices improve health outcomes by addressing the root causes of health disparities. And it's done through culturally grounded, community-based, and holistic approaches to care. And it goes beyond the biomedical model to restore balance and to foster connection. And it's really about empowering individuals and communities to take the lead in how they want to receive their health care. And when we look at Indigenous-led services that are guided by traditional knowledge, that it puts the decision-making power in the hands of the communities. And that improves relevance, effectiveness, and sustainability of health programs that are designed and delivered.
And I can attest to that. Working in the community for over 16 years, I've seen the value and the great outcomes, improved outcomes of the people that I serve when we've done this. So it's really vital and important to ensure that that's delivered that way. So someone can start learning about Indigenous culture in a respectful way by being open-minded and not judge and criticize, reaching out to various media such as books that are written by Indigenous authors, attending community events, ceremonies if they're welcome there, and really by reaching out to their local communities to find out what Indigenous people are actually living there, be it First Nation, Inuit, or Métis.
Yeah, I agree. It requires a mindset that's rooted in humility, openness, and relationship building. And it's not just about acquiring knowledge, but it's about honoring the lived experiences, the traditions, and the histories of Indigenous people. Well, I would say that for me, at the Indigenous Primary Healthcare Council, I found a place where I could align my professional skills with my cultural values. And my leadership role is really rooted in the belief that Indigenous health must be guided by Indigenous knowledge, Indigenous systems, as well as governance. And in my role here, I'm able to advocate for culturally safe and trauma-informed care. I'm able to support Indigenous models of care and promote two-eyed seeing across the sector. And I'm able to mentor the next generation of Indigenous health professionals.
And I think for me, my history in nursing has been community health. So I was in there working in my community for over 16 years. And then I transitioned into primary care where I managed a team at one of our Indigenous primary healthcare organizations. I've now transitioned into the health system transformation manager position at IPHCC. And it's a wonderful way for me to take those experiences and exposure that I've already had and then to put it into creating change either through educating our allied external organizations or really just to be aware of where change needs to happen. For me, Indigenous nurses can really create change and help to transform our healthcare system by incorporating traditional practices and cultural values into the care delivery that they provide. Advocating for Indigenous voices to be heard and to be recognized in the care delivery is essential for improved healthcare.
I agree. I think Indigenous nurses are at the forefront of transformational change. They're not only delivering care, but they're also leading in policy, education, governance, and cultural revitalization. We're seeing many nurses, Indigenous nurses, now stepping into leadership positions, and so holding positions of power to be able to make change at governance, leadership, and advocacy levels. I think my message would be that you belong here. Your voice, your knowledge, your experiences, and your culture are not only valuable in healthcare, but they're needed. When you choose a path in health, you're not just choosing a profession. You're becoming a healer, an advocate, and a bridge between two worlds.
Yeah, I totally agree. And there's so many opportunities to learn and lead in healthcare. And our Indigenous youth coming up behind us can provide such great fresh ideas to create a positive change and really impact the healthcare of themselves as well as their community.